Raising awareness about the Ebola epidemic that is currently raging through Liberia, Sierra Leone, and Nigeria is imperative, both for the affected areas and for those of us in our homes watching this on our screens, as curious and somewhat concerned bystanders. There are several barriers, however, that stand between us, the Americans, and those we seek to assist, wherever they may be. One such barrier is the cultural one that exists between the volunteers from first world countries who are swooping in to assist the countries affected. While we like to think of ourselves as advanced, we are often portrayed as arrogant morons who come trying to help, but only manage to make a bigger mess. And indeed, this caricature is not entirely inaccurate. On some notable cases, our own cultural ignorance has caused grave offense. We, as Americans, are rather infamous for blundering in and muddling things up further. This barrier is difficult to surmount, but we have only sent our aid workers to places where we have been explicitly invited to prevent misunderstandings. Another obstacle is the fact that some people believe that the Ebola outbreak is exaggerated. They are under the impression that it's all a ploy from the governments of the affected areas, a scheme invented in order to steal money from the relief efforts. As these persons are in a state of disbelief, or, as it can be argued, denial, they are not open to learning all they can about the prevention of the disease. All we can do about this is to continue to emphasize the consequence of the matter. Yet another stumbling block is the local burial customs. The various cultures in the affected areas dictate a more involved burial process, demanding more physical contact than that of our own customs. When an infected patient dies, from a medical standpoint it would be best to dispose of the body as quickly and as sanitarily as possible. But, from a cultural standpoint, the dead are to be treated with the utmost respect. This is yet another contributor to the aforementioned friction between the relief workers and the local people. The most successful method of spreading awareness, or at least the most famous, is a song titled Ebola in Town, written by Samuel Shadow Morgan and Edwin D12 Tway, concerned local artists. The song is blaring from radios everywhere, and this infectious song's influence is thankfully more widespread than that of its eponym. Some other methods used are the more traditional posters, easy to read and in multiple local languages. They are displayed prominently in public places and are obnoxiously obvious. While not as innovative as Ebola in Town, they are extremely effective. My own idea for raising awareness is to go a more personal route than the posters and such. I would suggest that the local government and the aid organizations work together to set up information booths in the affected areas.
Ebola is a highly infectious and often deadly disease that causes a variety of symptoms, from headaches, nausea, and fever, to bleeding through the eyes, ears, and other orifices. It has an incubation period of 2 to 21 days, during which no symptoms may occur. As soon as symptoms do arise, however, the disease becomes highly contagious. It is transmitted through contact with bodily fluids and not the air, unlike diseases such as influenza. The current Ebola epidemic in West Africa began when an outbreak was detected in late March in Guinea. The country's Ministry of Health informed the World Health Organization that 49 cases and 29 deaths had occurred as of March 22nd. Now, as of August 28th, there have been 3,069 cases with 1,552 deaths. This is a chart detailing the number of cases and deaths in Guinea, Liberia, Nigeria, and Sierra Leone. There are many ways to contain the Ebola epidemic and stop it from spreading to a pandemic. This includes practicing safe medical procedures. The MSF, which is the acronym for the French name of Doctors Without Borders, has, in their own words, extremely rigorous safety procedures in place to contain the disease as much as possible and prevent those who are unprotected from coming in contact with the virus. Since Ebola is spread through contact with bodily fluids, it can also be transmitted through its deceased victims. The traditional burial practices of the regions in which the Ebola epidemic is located include washing, touching, and even kissing the body. Deceased victims are still contagious due to the fact that they retain their bodily fluids for the most part, and these practices are very unsafe because of the very high death rate of Ebola. In fact, The outbreak in Sierra Leone is thought to be caused by one funeral at which 14 people were infected. The World Health Organization has a set of recommended burial practices that they have established to prevent the transmission of Ebola from the deceased. These recommendations include wearing protective clothing when coming in contact with the deceased, as well as disinfecting all objects, including the body itself, that come in contact. The body should be disinfected with a bleach solution, then placed in a body bag, which should then be disinfected itself, and then placed again in a coffin. The coffin should be transported to the burial site and then buried in a grave at least 2 meters deep. Since Ebola cannot be transmitted through the air, travel through infected areas is acceptable, although it should be minimized. Often during disease outbreaks, the use of quarantine is necessary. Those who may be infected should be observed for the entirety of the incubation period, 21 days. Infected persons should be quarantined immediately and treated as soon as possible. Health facilities or even entire areas may need to be quarantined. No unprotected persons should enter the quarantined area, and none should leave without proper disinfection.
Studios presents Ebola Virus, the Treatment by Dylan and Aaron Gonzalez. Treatment. No specific medicine or vaccine has been proven to be effective against Ebola, but there has been an experimental drug used known as ZMapp. ZMapp is a cocktail made up of 3 antibodies that attack the virus. Symptoms of Ebola are treated as soon as they appear. Keeping basic hygiene when used early in the incubation period can help lengthen survival. Some basic things are always wash your hands, maintain electrolytes, treat infections as they occur, maintain oxygen level, and maintain blood pressure. This chart shows the Ebola outbreaks since 1976 to present day 2014. The yellow shows the people who have survived, and the green represents people who have died. As you can see, the most affected was in 2014. CDC has deployed several teams of public health experts to the West African regions and plans to send additional public health experts to the affected countries to expand current response activities. The only person to live through the horrible Ebola virus outbreak in West Africa is Sasabis Tame Sandu. Sasabis was treated by Doctors Without Borders and has fully recovered. This is the Ebola outbreak in Africa.
West Africa outbreak. Sierra Leone has been hit the hardest with over 450 confirmed cases of Ebola at the beginning of August. Despite the lack of cure for the Ebola virus, doctors are able to treat the symptoms of the disease: diarrhea, vomiting, and high fever. Health workers are educating local populations about the disease and the necessary measures to take if you have the Ebola virus. Ebola outbreak in Guinea. Suspected and confirmed case count, 648. Suspected case deaths, 430. Laboratory confirmed cases, 482.
At least 59 people have died after contracting a mystery illness in Guinea since early February. Of the dead, 13 have been confirmed as Ebola cases. The orange in this graph represents affected districts. The yellow represents the areas under investigation. As you can see, most of it is in Guinea, but there are some regions in Sierra Leone and a few regions in Liberia.
Ebola outbreak in Liberia. Suspected and confirmed case count, 1,378. Suspected case deaths, 694. Laboratory confirmed cases, 322.
Several border crossings in Liberia have been closed to try to halt the spread of the deadly Ebola virus. As you can see in this graph, you can see that the orange represents the deaths, the yellow represents the cases, and the really light yellow, almost white, represents the countries with suspected confirmed cases, and the black dots represent the reported cases. As you can see, there are a lot of black dots in where there's the borders between Liberia, Sierra Leone, and Guinea all meet in one point. And in Guinea, there are 314 deaths, in Sierra Leone 219, Liberia 127. And just in general, there are a lot of infected people in that area. Just a lot.
Ebola outbreak in Sierra Leone. Suspected and confirmed case count, 1,206. Suspected and confirmed case deaths, 422. Laboratory confirmed cases, 935. Symptoms. Symptoms show up 2 to 21 days after infection and usually include high fever, headache, joint and muscle aches, sore throat, weakness, stomach pain, lack of appetite. As the disease gets worse, it causes bleeding inside the body as well from the eyes, ears, and nose. Some people will vomit or cough up blood, have bloody diarrhea, and get a rash.
An outbreak of the deadly Ebola virus is spread by close contact and kills between 25 and 90% of victims. There is no cure or vaccine. In this chart, you see the blue represents the early stage symptoms and the red represents the advanced stage symptoms. Some of the early stage symptoms include headaches, fevers, muscle pain, sore throat, and you become really fatigued. The red stages, which are the advanced, include internal and external bleeding, rash, vomiting, diarrhea, impaired liver and kidney damage, and bleeding from your eyes, nose, and your mouth. Preventative measures. Stop contact with infected animals and the consumption of their meat. So that means just don't go out there and buy a steak from the supermarket. Isolate the sick, because you don't want dead bodies hanging around your house, do you? Prompt disposal of victims' bodies. As I said, don't have dead bodies laying around your house. Disinfect homes of dead and infected, because you could catch the disease really easily. If there's like splattered blood on the wall, or you come in contact with their feces or urine, you're going to get really sick and get the Ebola virus. Wear protective clothing for healthcare workers. So that means you want to keep the healthcare workers safe and give them protective clothing so that the people who are taking care of you are trying to give you care so they don't get the Ebola virus, because that would be really bad.